Okay, so this week we are covering inflammation, infection. The beginning of your module says that we're focusing on the concept of infection, but we cannot start talking about infection before we talk about two other concepts, inflammation and immunity. You are going to be covering the concept of immunity in later courses, but I need to just introduce it because it is front and center in the infectious process, the immunity and the inflammatory response. Um, First and foremost, inflammation is a biological response of the immune system, and it could be triggered by a variety of factors. It could be pathogens, it could be damaged cells, it could be toxic compounds, it could be irradiation, and what the inflammatory response and the inflammatory system tries to do is remove that injurious stimuli and initiate that healing process. That's if everything is happening in a good way. Then inflammation it would be a defense mechanism, and it is vital to the health, and it's part of the immune response. And that's the inflammatory response that we're gonna talk a little bit about the causes, and we said what causes inflammatory response, and then what happens. Why do we see the signs we see on a patient when they're having inflammatory response? What are the reasons for the warmth, for the redness? So, and we'll talk about those signs and on a local level and on the systemic level. But I really wanted to highlight for you that we cannot really talk about inflammation without talking about the immunity. And immunity is the ability to maintain homeostasis within the environment that is filled with microorganisms. And I put for you in the YouTube channel a nice um, video. It kind of sums up those three concepts, how they work together in a simple injury that we get. I also put a nice video about inflammation and then a more in-depth inflammation pathophysiology, kind of for those of you who want to know more, but you don't have to. It's there in shell in the YouTube channel if you wanted to um, um, have further knowledge. Maybe down the line, you'll always have access to this YouTube channel and you'll see my videos there. So again, when we talk about the concept of immunity, there is normal and abnormal immune response, and there are multiple healthcare related issues. But not gonna focus on it here, other than when we talk about that physiological response or process within the inflammatory concept. This is the definition of inflammation, and if we look at the Latin origin of that concept, we find the word inflammar that says to set on fire, and you're going to see how those symptoms resemble as if the body is on fire. But in reality, inflammation is an immunological response, and it's a defense mechanism against any type of injury, not only infection, but just a simple cut wound or an allergy or hypersensitivity. It will induce an inflammatory response. And so part of the inflammatory response that it happens because the body wants to respond by eliminating the initial cause, by removing the damaged tissues and generating new tissue. That's the goal of the immuno-inflammatory system. And sometimes we will have an abnormal inflammatory response, and in that they call it dysregulated inflammatory response. For example, sometimes in some types of bronchial asthma, you'll have some inflammatory response that exacerbate the asthma, or in the fact where the arterioles are responding in a inflammatory way to all those plaques, and then you'll get atherosclerosis. So that is kind of where it is not achieving that original goal. Although it, even in those cases, it sets itself to destroy the organism that is causing, or any the thing that is causing the harm, digesting it, neutralizing it, and do its business of getting rid of it. In that process, sometimes it doesn't end where we want it to end. And thus, you learn that the inflammatory response is going to be kind of like a scope where there's no inflammation to active inflammation. And that active inflammation can be either acute, chronic, or restorative or repair. And we spoke about the response. So the initial response, it could be from a mere splinter in your finger or in your toes, to a crushing injury from a motor vehicle accident, to a burn, uh, to an infection such as viral, bacterial, or fungal infections. So we'll talk about all these infections in the infection module and or concept in that PowerPoint. But in here, we're going to focus on the inflammatory response. When we meet virtually, be prepared that we're going to be looking those terms up. We're going to be answering to those terms. We're also going to be answering to the cardinal signs of inflammation. So we'll discuss that in class. Also, we're going to be looking at examples of different types of injury that can lead to inflammation. What are those examples? If you look at the lifespan in kids, what do we see versus in adulthood and in older geriatric generation? So we spoke about the scope of this concept going from no inflammation to active inflammation. And in that active inflammation, you saw that it could be anything from acute to chronic to restorative. So that you'll see in figure 23.1. Also, you're going to see the inflammatory response and those inflammatory factors and their effect. I would advise you to be familiar with them, understand the process. Like I said, I put a video that explains it in a very nice way, and this table also depicts how those prostaglandins work. Like what do they do in the inflammatory response? Bradykinin, the complement proteins, the histamine, interleukins, the platelet activating factors, and the TNFs and the TGFs. So these all, look at them and familiarize yourself with these terminologies, with these responses, because they're going to be following you as you move with your studies. To understand what happens, you need to understand these elements. To differentiate between acute and chronic inflammation, acute inflammation is a relatively short duration, like from few minutes to several days, and you'll see the exudation of fluid, you'll see the elements, all the plasma components and leukocytes migrating into the extravascular tissue to finish the business of healing. Where versus chronic is where it lasts longer, from days to years. And here you'll see more of the advanced leukocytes, the lymphocytes, the macrophages, and you'll see fibrosis and maybe tissue necrosis. And that's where you talk about repair and restorative stages, where the body goes into those stages as well. As we stated earlier, the inflammation is a biological response of the immune system. So it uh, makes sense to have a quick review of the immune system before we move on. In this presentation about the immune response, we're not going to talk about the failure of the immune response or the abnormal immune response, because the scope also of the immune response goes anywhere from immunosuppression to exaggeration of the immune response. We're going to talk about a normal immune response what are the elements and what is the functionality? The immune response actually uh, performs three primary protective functions. It protects the body from invasion of microorganisms and antigens. It removes dead or damaged tissues and cells, and it recognizes and removes any cell that is foreign, that is mutated, any abnormal cell growth, such as in cancer. So it recognizes self from non-self. And uh, the components of the immune system include major organs throughout the body as well as cells. So the lymphoid organs include the bone marrow, the thymus gland, the spleen, the tonsils, the adenoids, your appendix, and then for example, in the bone marrow, lymphocytes are formed. Lymphocytes are one type of white blood cells. There's the B lymphocytes and the T lymphocytes. And the B, for example, is produced by the bone marrow and grows in there, and then it grows up to become the humoral immune response that produces the antibodies. So the B cells are the ones involved in the production of antibodies, and that's the word humoral because it goes into the blood. Versus the other type of lymphocytes is called the T lymphocytes. These also are birthed in the bone marrow, but they go to the thymus gland and they mature in there. So these are the main two types of lymphocytes that really form the smart immune response. Um, what else you need to know? Of other white blood cells other than the lymphocytes, you have the phagocytes. They also recognize and ingest foreign antigen when they enter the body. Those are the macrophages. You have the neutrophils, which are the primary phagocytic cells. They're usually the first to respond to during an immune response, and they kind of are named the first line of defense. Then you have the complement system, which is the system that works to enhance the immune response and to help the body get rid of the complexes and clean up the mass. Um, B lymphocytes and T lymphocytes, you're going to meet them again. I have an extensive lecture in the pathophysiology class about the inflammatory response and the immune response and all types of immunity, which I'm going to post also in the YouTube channel. If somebody wants to be more informed, you're most welcome to listen to that. I'll post that also in there. So, like I said, B lymphocytes are the humoral response, so they're involved in the immune antigen antibody interaction. And it has one elevated level of immune response in that it has a memory. It remembers the antigen, and once it comes back again, if it fights it the first time and builds an antibody against it, once it sees it the next time, it doesn't have to go through the whole process. It immediately kills, and so it has that memory. Uh, the T lymphocytes also have killer cells and memory cells, but they have those T helper cells. And the T lymphocyte response is kind of more important than any other response because they're the brain, and the T helper, which is the CD4 that you see in AIDS, HIV infected patient, that's the cell that is impacted. So you'll see that they'll lack the whole immune response because the T helper helps, literally, like the name implies, in that immune response. So again, you can go into your book to concept 22 immunity and read the whole chapter around this. Get familiar. You can listen to my video presentation. It's also a PowerPoint presentation from the patho class around immune response if you want to be more informed around this. So what happens? Why do we need the inflammatory response? We already discussed these in a couple of slides before. Just to sum it up, is that the uh, acute inflammatory response is complex, like there is maybe 16 steps in it, but they're sequential. If you look at figure 23.2 in your book, it has it as a visual, and you'll see that there is constant interaction and a feedback system. And it goes step by step from the injury to vasodilation, increased blood flow to the area, swelling, then increased vascular permeability, then walling off of the area, like they say, then margination of the white blood cells, then you'll see the exudates, then you see glucose and sugar movement, and then the rest of the chemical release are so it's a step-by-step process to achieve the goal, either restitution of normal and back to healthy cells again, or when there is the failure in the restitution of the um, normal, you'll have the fibrosis, which is, a kind of an undesired effect of inflammatory response. The acute inflammatory response involves two major components, the vascular and the cellular. At the vascular level, you're going to see that there's changes in the small blood vessels at the site of injury, and it begins immediately. First, there's like a vasoconstriction, then there's a rapid vasodilation that is achieved by the mediators, and then you'll have the migration of the leukocytes, and to achieve that, there is many tissues that will help the endothelial cells that align the blood vessels do that, the circulating white blood cells, the connective tissue cells such as the mast cells and the macrophages and the lymphocytes, as well as the extracellular components such as the collagen and elastin. So these are all the inflammatory mediators that help in the first stage. And so what happens is that you'll get into the vasodilation, and eventually you'll have increase of in capillary blood flow, and that's how you see the heat and redness, the two cardinal signs of inflammation. And then you'll see an increase in vascular permeability when all those protein-rich fluid exudates go into the extravascular space. And so then you have the increase in interstitial osmotic pressure. And this, along with the increase in capillary pressure, you'll see the fluid moving more and accumulate in the tissue spaces, where you'll see the other marked signs of inflammation, the swelling, the pain, and the impaired function. So with this, when this happens, what you'll see is the fluid, with the fluid moving out of the vessels, you see stagnation of blood flow, and kind of they try to clot the blood so that it'll help forming a wall, so it localizes the infection in one place. Next, you'll see the cellular phase, where you see the leukocyte migration and the adhesion and the transmigration. And in that phase, you see polymorphonuclear neutrophils, which are known as PMNs. They migrate into that site and they start performing their normal function, which is the phagocytosis. And here you see a series of reactions geared towards that inflammatory response. At the end of this inflammatory response, you will see that the two major phenomena happen: phagocytosis and cell killing. In the regular inflammatory response, the acute inflammatory response to an injury, you saw those vascular changes, you saw the vasodilation, you saw the capillary permeability, you saw the influx of inflammatory cells from neutrophils to the other inflammatory mediators, and then you saw those cardinal signs of inflammation on the local level. So I wanted to hit a little bit on the systemic signs, more that fever, those increased white blood cells will be more of the systemic symptoms of inflammatory response. But what you wanted at the end from an inflammatory response is to resolve. Sometimes what happens, especially like with swelling, you'll see some damage from the compression. But also the inflammatory response that is not resolved will become chronic inflammation, and you'll see instead of seeing those neutrophils, you see more of macrophages, lymphocytes, fibroblasts, and you'll have persistent inflammation, and you'll have scar formation, and so where do you see those? You see them in some of those uh, infections, some of viral, bacterial, also some of other fungal infections, but like your tuberculosis, your TB, your the syphilis are chronic conditions that stay in and show those um, systemic pathology. But we'll talk about these three conditions in a second. So other systemic markers are your CRP, C-reactive protein, erythrocyte sedimentation rate or Western sedimentation rate. And when those are elevated, they'll know that there is an inflammatory response that is showing, that is there, but not showing as obvious as an acute inflammation. And you'll see them do more specific tests to reveal those underlying conditions. Those systemic pathologies really happen because of those negative consequences, like I stated in the beginning, and sometimes it's due to an exaggerated immune response to stimuli, resulting in additional tissue damage, or on the other side, when we talked about immune response, either can be exaggerated or under and inadequate. So basically, these examples, atherosclerosis, chronic renal disease, and neurological disorders, some of them are due to the pathological systemic inflammatory response. And it affects variously. I mean, it affects individual variously, and latest evidence base, like we were talking about evidence base, have shown that inflammation has a relationship in that coronary artery calcification and the development of coronary atherosclerosis. The same with the kidney diseases, chronic renal disease. They also found a pro-inflammatory state that existed with patients who consequently developed kidney disease, renal disease. Same with the Crohn's disease, the ulcerative colitis. They're called inflammatory bowel disease. And some of the neurological disorders have also been correlated to autoimmune diseases and inflammatory rogue inflammatory process as well. So who is at risk? And in the most of our learning, we will see that the very young and the very old are going to be at greatest risk for most of the vulnerabilities because they're really the vulnerable. So your socioeconomically challenged person, your people with low immune status, be it whether it's acquired secondary low immunity or because of their age, the very young has not yet developed that adaptive immunity, and the very old has lost some of those with the wear and tears, have lost some of those capabilities. And one of the things, like in the very old, the thymus gland starts shrinking at the age of 50. So we talked about T lymphocytes, and so you can appreciate how that would be, the response would be affected. The inflammatory response is affected in those two. And of course, the uninsured is the person who's not going to be able to get to access to health in due time. So if they had an acute inflammation and is not treated, that would have an impact. Also, you're homeless because of their living conditions, and the person who's of low socioeconomic class that cannot afford insurance, or the of a socioeconomic class where they can afford insurance, but they have to work 2, 3 jobs, and now you have the stress. And stress is one of the leading factors in those dysregulated immune response because of the weight that their stress puts on the body. So instead of having the allostasis, which is a similar term to homeostasis, allostasis is where you balance your stresses with the response to stress, and then you get overloaded, and then the body's response is weakened. So we'll talk more about those risk factors, explore more, tell me more about them in the classroom. In class, we are going to be looking at the clinical manifestations, clinical findings that are correlated with inflammation, and we'll discuss those in details. We also are going to talk in more details about diagnostic testing. What do we use the CBC for, the WBC, the CRP, ESR? What are some serological tests that are done? And in those radiographic tests studies, what they're looking for in an MRI, in a CAT scan, in a PET scan versus a colonoscopy, what they're looking for. I want you to bring those to the table when we're discussing in class. The nursing interventions, pretty much when we talk clinical management, we're focusing on our nursing process. And kind of the interventions in here are geared towards primary prevention, secondary prevention, tertiary prevention, in a indirect way of how we're dealing with the nursing process here. So if we can assess and and put a plan in place to from the beginning have the nursing plan of preventing inflammation from happening. So you saw in the COVID response, the main thing was maintain good hygiene, wear your safety equipment, and so thus you're reducing the chances for the risk and injury and infection. And whatever is, we said we're going to discuss a couple of the conditions that are associated with an inflammatory response. So you can tell me some of the ways we can prevent those from happening versus. So we saw that we can prevent the injury from happening in the beginning. So we can prevent the triggers for asthma if we teach the asthmatic patient what are the triggers and prevent the exacerbation of asthma, not the development of asthma, but exacerbation of asthma. But in the case of the patient, for example, developing the inflammation, do we have another secondary prevention to prevent it from going any further? There's no specific screening, but there are some collaborative interventions that we can go for. And mostly your collaborative interventions are going to be geared towards mediating the inflammatory process so it can get to the repair and healing, and mitigating the ill effects of the inflammatory process. So what you want to do is help minimize the swelling. So you use the RICE acronym, rest, ice, compression, elevation. So, and then you use some of those non-steroidal anti-inflammatory. So we'll talk about these, how high is high, how much ice we should put on there. Do we need to, is there a timing for that? When we apply the compressant device, what are some of the things we need to monitor for this? Um, Also, we'll talk about some of the pharmacological agents, but mainly the main ones you've seen are those anti-inflammatory. The big gun in anti-inflammatory is steroids, because it's an anti-inflammatory. But then you have those non-steroidal anti-inflammatory, and then you have those some of the recombinant DNA monoclonal antibody um, used for the treatment. You'll see also antipyretics used. You'll also see analgesics used, and you may also see antibiotics used, antimicrobials, depending on what is the cause of the inflammation. And finally, before we close the loop on this concept, remember we said immunity, infection are and inflammation are almost always present in the same picture. When we think of inflammation, we're gonna have that concept of, do we have impaired tissue integrity in there? Is there an ineffective thermoregulation? If it's the lungs that are inflamed, are we gonna have any impaired gas exchange? If again, the swelling, that fever is gonna bring about fatigue, activity intolerance, and then stress and coping. We spoke about that and how it's gonna add up to hinder the healing from inflammation. And along the road where you're going through this program, you are gonna meet these exemplars. You see atherosclerosis in third semester, you see cirrhosis in fourth semester, and so we'll discuss some of the minor ones just because you're gonna meet them. Maybe bronchitis and asthma. Have a case exemplar around that for the this week. Thank you for listening.